537 million people worldwide are trapped in a battle with diabetes, and science may have just found the key to end it.
What if your body could be reprogrammed to produce its own insulin again? Clinical trials say yes, and here's the proof.
Today, we expose every real clinical trial that is making insulin production in humans a breathtaking reality. In a healthy pancreas, beta cells inside the islets of Langerhans produce insulin, your body's master key for blood sugar control. In type 1 diabetes, the immune system wages war on these beta cells, destroying them completely and cutting off insulin forever.
The cost? 537 million patients, $966 billion spent annually, and millions dying from complications that proper insulin could prevent. The journey began in 2000 with the Edmonton Protocol, the first successful transplant of donor islet cells into type 1 diabetic patients. All 7 patients in the original trial achieved insulin independence, a result that stunned the entire medical world in 2000. But there was a fatal flaw. Donor islet cells were dangerously scarce, and patients needed lifelong immunosuppressive drugs.
Scientists then asked a revolutionary question. What if we grew insulin-producing cells from scratch, using stem cells?
Vertex Pharmaceuticals developed Zimislecel, stem cell-derived beta cells now in phase 3 human trials, infused directly into the liver. In 2025, UCSF infused Zimislecel into patients. Early data showed the transplanted cells establishing blood supply and beginning insulin production. Then came CRISPR gene editing. Scientists could now modify cells to make them invisible to the immune system. Sana Biotechnology created hypoimmune cells, genetically cloaked islets that evade immune destruction without any immunosuppressive drugs. In December 2024, Uppsala University gave a 42-year-old Swedish man 17 injections of gene-edited pancreatic cells, a world first in human trials. For the first time, gene-edited cells evade both transplant rejection and autoimmune attack. Lead researcher Dr. Per-Ola Karlsson of Uppsala edited cells can survive in a human type 1 diabetic body. Professor Per-Olof Berggren of Karolinska Institutet confirmed in May 2026 that patient-specific insulin cell therapy is now a real achievable target. Post-tech scientists in South Korea went further, 3D bioprinting a functional mini pancreas from living stem cells with its own vascular architecture. Their HyCa-V platform used real pancreatic tissue proteins, laminin and collagen, to recreate a microenvironment matching a real human pancreas. The bioprinted cells produce significantly more insulin than standard lab-grown cells, mimicking the body's own natural glucose response. In May 2026, Karolinska scientists cracked a key code, reliably producing high-quality insulin cells from multiple different human stem cell lines. Your own cells like no rejection. Cells grown from your own DNA could one day eliminate immune rejection entirely. Stanford medicine researchers took a different path, resetting the entire immune system alongside islet transplantation to cure diabetes in animals. The result? Complete cure in type 1 diabetic mice with 0 graft versus host disease, paving the road toward human application. For 8.4 million type 1 diabetics who inject insulin daily, these trials offer the promise of a future with no injections and natural insulin production. For type 2 diabetics, cell therapies could regenerate exhausted beta cells, restoring insulin sensitivity and reducing drug dependence significantly. Current trials show transplanted cells surviving over 1 year, producing insulin on demand without daily medication in select patients. Despite breakthroughs, 3 major barriers remain: immune rejection, high production costs, and scaling cell manufacturing for millions of patients. Experts estimate the first approved insulin cell therapy for humans could reach patients as early as 2028 to 2030, pending phase 3 results. From 2000 to 2026, every decade brought a leap, and now multiple parallel trials are converging toward the same goal: ending insulin dependence.
The bigger picture is revolutionary. Scientists are not just treating diabetes, they are biologically engineering a cure from living human cells.
If you or someone you love lives with diabetes, know this: science is moving faster than ever, and real solutions are closer than you think. The cure for diabetes is no longer a dream. It is being built, tested, and proven in human beings right now. The future is insulin-free. Subscribe to the Diabetes to Reversal channel for educational videos, press the bell icon, and share it with your friends.